Insa is a 25-year-old man living in a region of West Africa where sickle cell disease, or sickle cell anemia, is a common genetic disorder. As a homozygous sickle cell patient, he has spent most of his life managing the challenges imposed by his condition: painful vaso-occlusive crises, increased susceptibility to infections, chronic organ complications, and the psychological impact of living with a chronic illness. The healthcare system in his region has recently adopted the One Health approach, a holistic strategy acknowledging the interconnectedness of human, animal, and environmental health. This approach aims to develop integrated solutions to improve the overall health of populations by considering the multiple factors that influence diseases. One day, after yet another painful crisis that landed him in the hospital, Insa embarks on a deep reflection. He wonders how the One Health approach could be applied to improve the management of sickle cell disease, not only for himself, but also for others in his community. He decides to dedicate the next 3 days to exploring this idea. Day 1. Understanding sickle cell disease through the One Health lens. Insa begins by deepening his understanding of sickle cell disease. He learns that this genetic disorder results from a mutation in the beta-globin gene, leading to the formation of abnormal hemoglobin S. This hemoglobin deforms red blood cells into a sickle shape, causing rigidity and aggregation in small blood vessels. He realizes that sickle cell disease cannot be addressed solely from a medical perspective. Environmental factors such as climate, extreme temperatures that can trigger crises, nutrition, vitamin and mineral deficiencies weakening the immune system, and infections, malaria, bacterial infections, significantly influence the frequency and severity of crises. Day 2. Integrating animal and environmental dimensions. On the second day, Insa explores how animals and the environment interact with sickle cell disease. He discovers that certain zoonotic infections can worsen the condition of sickle cell patients. For example, malaria, transmitted by mosquitoes, is particularly dangerous for them. He also considers the impact of the environment, such as air pollution, which can trigger crises by reducing tissue oxygenation. Insa understands that preventing infectious diseases transmitted by animals and improving the environment can have a positive impact on the health of sickle cell patients. He envisions measures such as mosquito control, reducing pollution, and improving access to clean water. Day 3. Developing an innovative strategy. On the third day, Insa decides to develop a concrete strategy. He focuses on genetic counseling as the main tool. He recognizes that preventing the transmission of sickle cell disease involves informing and educating couples of childbearing age about genetic risks. Insa proposes creating community-based genetic counseling programs integrated into local health centers. These programs would be designed to be culturally sensitive, respecting the traditions and beliefs of the community. He also suggests including educational sessions on the importance of vaccination, nutrition, and hygiene to prevent infections and reduce crises. Implementing the strategy. To bring his project to fruition, Insa seeks the help of various professionals: doctors, geneticists, veterinarians, ecologists, and social workers. They form a multidisciplinary team to develop workshops and educational materials. The genetic counseling workshops inform participants about sickle cell disease, modes of transmission, and options available for couples with the sickle cell trait. They also introduce the concept of prenatal diagnosis and early management possibilities. Concurrently, public health campaigns are launched to fight malaria. Distribution of insecticide-treated bed nets, insecticide spraying, and awareness raising on eliminating stagnant waters. Initiatives to improve air quality, such as promoting the use of clean cooking fuels, are also implemented. Results and impact on the community. Over time, INSA's efforts bear fruit. Sickle cell patients report a reduction in the frequency and severity of vaso-occlusive crises.